Nice to be here sharing with you some of my views and my perspectives on this issue. So the talk today will be regarding eHealth versus eBanking, the trust breaking points. And so I'll start with a question to you. You don't need to answer, just in your mind, but I'm sure I probably can kind of guess more or less that around 96 to 98% of you I'll know the answer for sure, because which one do I trust more, eHealth and eBanking? We haven't thought much about it, but maybe we can just have an idea of what are the trust breaking points that make us decide on one over the other. So let's start. So point one, again, as we all know by now, that how much is a medical record worth? So it is worth a lot in comparison with the next second record, which is the credit card or bank account information. So it can go up to 50 times plus the credit card record, and it's worth like that in the black market. So I'm sure it's something that many organized crime and many people that looking for other means of gaining money will go for it, and that's why maybe that's one of the main reasons why it is so much sought after for the past years. So yeah, it's point one is gain. So research suggests that main attack vectors for this kind of medical records, of this kind of data, are ransomware. I mean, there's nothing new here, I'm sure. Ransomware attacks have increased a lot over the past years, and especially now with the pandemics, more focus has been put even more in the healthcare domain, and also SQL injection. And so this is just some data from IPA, so mostly from US. We see that most of the breaches are caused by hacking and IT incidents, and it's really quite a difference from this to the next one, which is unauthorized access. Okay, so it's really something that is focusing on healthcare. And then the location of breached data usually goes through network servers and email. I'm supposing that ransomware goes a lot via email. And then obviously once you get inside the network via ransomware and all the malware and everything, you can further attack other places and get to more sophisticated attacks via the network. And then who? Well, we can think obviously about that hacker that we still have in our minds, but maybe this is changing, because especially in the healthcare business, we see that there should be organized crime. So there's a network where the business model is actually to steal medical data and sell it to the best price, I suppose. And then we have also via insiders, which is kind of worrying. And obviously third parties, we know that healthcare institutions work with many outsourcing in many third parties organizations. And this can also be a point that attackers can happen. And why? Why do they do that? Obviously, there is some advantage. Otherwise, they wouldn't waste resources and time doing it. And so much it is on the increase. So for commercial espionage, okay, that's kind of obvious. And then also to steal medical technology, the development of new technology. We saw that with COVID as well, with the vaccines and everything. And also data theft. I think that's the main point, because anyway, there's a lot of information to be gained. Let's say the patents, the formulas, the new, the innovation that is there, and obviously again the patient records, medical records that is there, and then I'm sure that is well sought for by many people, many organizations. We can think maybe in US situation where there are more organizations, let's say, involved in the healthcare industry. You can think about pharmacies, we can think about insurance and so on. But still here in Europe, and I'm sure all around the world, the problem is increasing also a lot. The type of information collection, we can think, I mean, it's a mixture. I'm sure we have the FOCA tools that can go around over the internet and see, okay, can do this generic overview of what is happening, checking for vulnerabilities and so on. And then obviously you can have also focused attacks for specific purposes. I'm sure once you have these FOCA tools working around, you can check some points of vulnerability and just go for it. And then you obviously can go for these focused attacks as well. So it's kind of what is needed, what is the goal, and then just go for it. Now we get to point two, breaking point two. We talk about availability. In fact, we talked about SIA because that's very important everywhere. It's the main dimensions of information security. But in case of healthcare, we mostly, I think the balance tends to availability being very important because you need the data there to be accessed by the professionals and to be able to treat the patient to make the most informed decisions possible. Obviously, that this is very important. In eBanking, maybe if you have some kind of time unavailable to access your bank account, probably is not so problematic as in the case of healthcare. So availability is quite an issue. But also, it's not about only availability. Obviously, if we have access to information when we need, it's very important. But then that information needs to have quality. So integrity enters here again. Okay, you can access it, but if it is not of good quality, you cannot make the best informed decisions. So everything is connected, and we need to find a balance there. Yeah. So point three, it also relates with SIA, but it's something different because it has the consequences of the problems of the attacks. So in healthcare, obviously, we can have physical and mental issues targeting people. Obviously, in the bank, you can have some consequences, some bad consequences, but usually these are very specific, not so generalized. I mean, and usually not with so serious consequence. Obviously, it can happen, but in this case, it's more direct, affects directly the health of the patients. I can give you two examples. I'm sure you've heard about them. It goes back to point two of availability. We know about the ransomware attacks. We have here two examples. One was in Germany in 2020. It was an hospital that was being victim of a ransomware attack. So it kind of closed the emergency department. So ambulances could not go there with the patient. So the patients had to go to some other location, further location. And there is a relation with a patient that had to go further 30 kilometers in order to be treated. And that may have caused, obviously, her death. And then in USA, it was even before the pandemic. There's also a case that is being sued there regarding also the case when the systems were unavailable to check all the tests while someone was having a woman was having a baby, and then they couldn't perform all the tests because the systems were not available at that moment, and that may have caused also the death of the baby because it eventually caused brain damages. They weren't able to see that there was an umbilical cord around the neck of the baby, and that may have caused. So it can have caused serious complications. These are just two examples. But then we can also have another part of SEO, can have integrity. And in this case, in the man in the middle, I'll just give you the example on the case where there could be a man in the middle attack of CT scans. So I can just use a Raspberry Pi and then just intercept, put it within the CT scan, connect it there, and then it can go and eavesdropping all the information that is being gathered by the patients. And usually, even if there's TLS, usually the payload is not encrypted. So they can gather the information and see what's going on, and they can mess with it. So what they can do, they can even use deep neural networks, and they can use this kind of GAN network and actually insert information in order to provoke or produce, let's say, new nodules in a cancer exam, or take them out. And when they did this, actually the radiologist misdiagnosed the information on those altered scans. So it is very, it is very dangerous, these kind of things, but it was really, really easy for them to do this, and with a very low cost technology. And then we can have just a simple example regarding confidentiality, just to finish the triad, the SIA triad. So we all know we have IoT devices, medical devices, used everywhere now. And these are still containing hard-coded passwords many times, which makes confidentiality very difficult to have, in fact. And then we know these kind of devices are very important because they try to monitor and support patients. But we see that the four main type of medical devices that are more susceptible to hacking are actually wireless infusion pumps, implanted devices, smart pens, and vital sign monitors. So this, obviously, you can see and think about the consequences this can have. So when you have hard-coded passwords with no encryption, and it's very easy to get to that device, and then from that device, which is obviously connected somewhere, you can go and enter around the system and do your damage. So now we can think another point, the point 4. It regards heterogeneity or diversity, which is supposed to be a very good thing nowadays, but it can also have its drawbacks. In terms of eBanking, for example, we don't have this kind of issues. I think at least it doesn't make sense for that context. But for example, we have in healthcare institutions, we can have like this very myriad of equipment in terms of technology. You can have many types of devices, IoT, medical devices, all the hospital infrastructures, eHealth. So you can have telemedicine. You can have many, many different things. How to control and actually integrate everything securely. It's still a very big challenge in terms of interoperability between systems. So how are you going to solve this issue? To gather even more or to add even more to the issue, we have users ecosystem. So in healthcare institutions, we know it's not only the employees and then the clients that go there, like in eBanking, we have many different types of users with many different types of objectives that can go there temporarily. They can come and go in very quick pace. So it's a very dynamic environment. You can have patients, students, researchers, all types of health professionals. So how are we going also to control all this, all the access control of these people who comes and goes when, for what period of time? So how can we provide better and more appropriate and dynamic policies that can actually translate all this? And then, okay, we have all this diversity, but maybe we don't have the diversity everywhere because then we have developers, and developers usually are a very specific, tiny number of people that are trying to control and manage all this. And in the case, it's like few developing for the needs of so many. And obviously, we have lack of expertise in the area, as we all know, lack of people, lack of resources, and obviously lack of communication then from these developers to all these people that are there doing their job every day. They don't know about what flows they need to perform. What are their real needs? So it's difficult to control and monitor and secure such an ecosystem, such a variety of ecosystem. So in one side, we have this heterogeneous ecosystem, and then on the other side, just a very specific number of people trying to promote and control all this in a very secure and private way, which obviously it's very hard. And all this leads us to point 5, which is the attack surface. Obviously, if you have all this kind of infrastructure ecosystem, very complex, obviously we have a big attack surface. So we can have many entry points, many vulnerabilities that can happen, and obviously it just need one vulnerability in order to enter the system and attack it and do your job. In terms of eBanking, again, it's what comes from before. The attack surface may not be as big or may not be as varied, so maybe it's easier to kind of control the entry points and okay, hopefully. And then we have point 6, uniqueness. So you come from heterogeneity, but in the end, you also have the uniqueness. In terms of eHealth, you have uniqueness of diseases, uniqueness of medical devices specific for specific diseases, rare diseases. So rare and specific needs, specific process and technology. So how also are you going to integrate all that? How are you going to control all that? Because for that, you also need the different types of risk assessment, impact evaluation. So how are you going to integrate all that also within all this ecosystem? And you reach point 7, which are resources. Of course, we had to talk about resources. So what is the currency? Obviously, in banking, we know the currency, at least it depends on the country, I'm assuming. But then in eHealth, the currency is the lack. So it's a lack of awareness, lack of infrastructures, education, expertise, lack of time, budget, and all that obviously is going to influence innovation. How are you going to have means even to control what exists, much less to try to improve things and make things even better and have new ideas and generate better and more protected systems. And then we finally reach point 8, which is in my presentation, the last point, last trust breaking point, which is time. Actually, I think that we can think that in terms of time, healthcare still needs to catch up with banking, because it's not only the case that just now we are starting to realize the value of our medical records and the issues that come from it, and the value of privacy of our medical records, while in banking, even before just as it started societies and transactions, we know that it was from the beginning the means we had to have means to protect our money, our currency, our assets. So there is this history of time that banking has somehow learned a lot and evolved in some way in order to protect all this small, let's say, ecosystem compared with the health. Now we need to catch up. Obviously, we don't have much time because technology is going very fast, and cybersecurity is not accompanying it as it should. And so for me, even before the current pandemic, we already had a cyber pandemic. The pandemic actually exacerbated and even augmented and make it more visible, let's say, the cyber pandemic. But I'm sure it was there before, and it's still going on, and it's still going strong. So it's not only about now, what is going to do now, but in healthcare, there's long-term consequences as it should have in banking as well. We know we had some issues regarding communications and all that, and the transactions. There were attacks lately, that, as you know. But still in healthcare, there can be long-term consequences as well, not only for the health of the patients, obviously, but then if, for example, attacks of ransomware, you have the data of the patients. You can do anything with it. From the moment you have it, I mean, there's no guarantee you're going to just delete it once you get your money or once you get caught. I mean, you can keep doing it, keep asking for ransom, causing disruption, causing reputation issues to the organizations, to the people. So it's very hard now to know what will be the long-term consequences, but I'm sure they will be there. And still with time, obviously, let's talk about diversity, inclusion, education, and innovation. Obviously, this is a very fashionable word now, but in fact, in cybersecurity and in healthcare especially, is very important. We have, as I said, very few developing for such a diverse people. We need to have means of developing cybersecurity technologies and solutions that actually focus and adapt to the needs of every one of us. We know that from young to old people, we now are we are using technology. We need to have our own security, our own privacy means of, and then for that, we need trust. I know that if we have all this, we can have trust. But in fact, it goes back to the trust breaking points. How do we get this trust? Well, we need really to try to make the most of it. I mean, after all these points that I told you about, and if I keep asking this question, I'm sure by now I would have probably 99% of answers tending from to one side of the scale, and so this cannot happen. I mean, we need to improve this. How can we do this? I think it needs to go back to trust. Since from the whole scale, from zero trust to trust, we know that zero trust technologies can have really nice ways of tackling some of the issues, especially in healthcare. I'm sure there's a lot of potential. We have all these medical devices, IoT, that should actually communicate between each other, making sure they check everything, they check the policies, they check all the interactions, they check what is asking, they authorize properly who is communicating with them, authenticating, authorize them properly. And then, okay, this could be one good thing. But on the other side, we have the users. It doesn't matter to have all this good technology, which is secure, hopefully, but then the users need to trust that technology to use it. We know that since the beginning of societies, what do we do in order to do things? I mean, every time we take a decision, we perform a risk analysis, even if it's not conscious. So even when we get out of bed, what is the risk of getting out of bed? What is the risk of getting out of the door? Even if that is already automated, we perform that every day. And we always kind of balance in our mind, do we trust this? Do I trust to do this interaction? Do I trust to interact with my fridge, with my stove, with something like that? So we need to have also this kind of idea of focusing on, okay, how are you going to improve trust in people while interacting with technology? This is very important, especially in healthcare, because this can have a lot of impact in people's health and treatment. Because we have the technology, we have eHealth, we have all this technology around, but it's not fulfilling its full potential, because for patients that have chronic disease, that would help them actually improve their monitoring, their health, their treatment, and they're probably not using because starting with trust. It may be all the other reasons, because it's boring, because it's not working, because something else. But I'm sure it starts with trust. If you start with the trust a bit higher, let's say more closer to the banking trust, maybe at that time, okay, there is more probability that they will keep using the technology and they will keep actually improving and making sure that it supports their daily lives. So I'll leave it like that. And just like that, I think if we solve cyber in healthcare, we can solve it anywhere for sure. Thank you so much for listening and for your attention. Thank you.